Welcome to the Healthspark, igniting healthcare management change and evolution. I'm your host, Dr. Raya. Hi, I'm Dr. Raya on the Healthspark, and today we have David Muns. Thank you, David, for joining us.
Thank you. Good to be here.
Hey, I'm going to give an abbreviated introduction about you because you have such an impressive bio. David Muns is a healthcare executive with over 25 years of leadership experience across clinical, operational, and academic roles. He's led organizations of varying size in both public and private sectors, consistently driving efficient, patient-centered operations. David is passionate about equipping healthcare leaders with practical strategies rooted in enduring principles of effective leadership. So welcome, David, to the Healthspark.
Thank you very much. Good to be here.
We're so happy to have you. So what we do with all of our guests is we like to hear a little bit about your background story. So tell us about your story. Tell us a little bit about your personal journey and how you ended up in healthcare.
Well, it's interesting. I have young people from time to time who ask me how I sort of arrived at the position that I'm in and the work that I do. And I tell them all the time that I'm very happy to share it. I don't know that you will be able to replicate it with all the zigs and the zags and those sorts of things, but I'm always happy to share. But I grew up in a very small town, about 1,000 people in East Central Georgia, small enough that I lived next door to my grandparents for many years. After high school, that led to joining the Air Force. I was an enlisted medic, did hands-on patient care while I was in uniform for a number of years. After that period of time, I sort of, as my clinical colleagues would tell me, transitioned over to the dark side and became an administrative type. And from there, I started my civilian work as a manager for a group of hospitalists where we went from about 60 patients a day to about 150. And over a period of time, I was fortunate enough to have people who trusted me and were willing to give me more and more responsibility. Moved into vice president roles, ultimately became a COO in a couple of different places, and now generally do most of my work as a consultant and an operations strategist and those kinds of things. So it's been a good journey, but it all started out as a bedside guy doing patient care, and ultimately then brought me around to being administrative type.
Excellent. Well, first of all, thank you for your service.
Thank you.
And I think that people, especially emerging leaders, often ask that question about how did you get where you are? Because I do think that they're looking for a formula, right? They're looking for like a plug and play, but you're right. It's not, I don't think it's a straight line for any of us.
Well, one thing that's different from many years ago is there used to be sort of a formula. If you did A, then B happens, and you could sort of matriculate your way through a system or multiple systems and work your way into whatever it was that you wanted to do. But one of the things that has significantly changed is there are so many facets to healthcare now that at times it's hard to make the plan, and you have to really sort of look at what the next step is and not 2 or 3 steps down the road, and put yourself in a position to be successful in what you're doing today. The best way to build a resume is to do work today.
I love it. I love it. Okay, that's a great tip that we hadn't talked about. So that's wonderful. All right, so tell us more about your work. You've led both large urban systems and in rural facilities. So what's the day-to-day look like in a place like Artesia? Because that's where you're at right now, correct?
Correct. Artesia, New Mexico.
Artesia, New Mexico. So what unique challenges and opportunities do you see in rural ops right now? So tell us more about your day-to-day work.
Well, one of the challenges that I will tell you that is consistent right now from large places to small places is access, patient access. Oftentimes it's different. That the reasons for lack of access may be different in a small facility versus a large facility. But I can tell you, when I worked in the San Francisco Bay Area, there was a significant amount of work being done to create access. And in that area, you're talking about a relatively affluent area. This is right through Silicon Valley. So
Right.
it wasn't as if people didn't have resources. There just simply weren't enough providers, physicians, and so forth to provide the appointments. Now, the challenge in a smaller place is obviously it's hard to attract a lot of the different talents that go into putting healthcare together for a community.
Right.
It's a big part of what we're doing now here, as far as day to day, is it's really we're trying to deal with this oftentimes in small increments. How many more appointments can we add to our family clinic? How many more ultrasounds can we do? Can we add a Saturday service? For example, we have open MRI now available 2 Saturdays a month, and in a small community, that's a big deal. We started offering mammograms to teachers. It was called Mammos for Mentors, where many of the teachers in the community who could not take time off during the week could come in on a Saturday morning and get their mammograms done. And so there were ladies who had been in the window for needing a mammogram for a number of years, that this was the first time they had actually taken that opportunity.
Wow.
So I often say that small hospitals are sort of like politics. People talk about how politics in small communities gets very personal. Healthcare in small communities gets very personal as well, because it's truly your neighbors and the people down the street that you're taking care of. So a lot of the work day to day is dealing with access. The other challenge that small hospitals have are bench strength. Artesia, for example, is a jewel. There are some very smart, very talented people here. But if something happens to one of your leaders, a director in a specialty like imaging or lab, it's extremely hard to replace one of those people without having to go to a contractor, which then adds an enormous amount of expense to your budget. And so it's hard to develop that sort of bench strength in a small place as well. So, and that in turn then impacts your access in many ways. So there are challenges that affect large places and small places, but a lot of times that bench strength and having the depth, you can have the talent, but you have challenges generating the depth, going, big picture.
Okay. Excellent. Not excellent, but fascinating. Yeah, that I can imagine how that would be amplified in rural communities. So I want to talk about innovation, and this means a lot of things to different healthcare professionals. And what I like about the podcast is that we're looking for innovative solutions to different problems, because we all have different problems in healthcare. So if we're talking about innovative solutions in rural settings, what have you seen that has helped in these rural communities, especially in the roles that you've been able to take and to assist in various rural settings that have made a difference in access, in outcomes, in operations?
Well, I think most of the small facilities really have to be flexible. You used the term innovative before. We have to find new ways of engaging our patients, and new ways of engaging schedules and creating access, and those things we talked about before.
Yeah.
An example of that is there is sort of a growing industry of organizations who are willing to do procedures and work in small hospitals in short time increments. For example, there are proceduralists who will come in and do vascular work in a small facility just 2 or 3 days a month. So instead of having to generate an ROI, or return on investment, on the cost of a physician for an entire month or a year or whatever the case, it can be done in 2 or 3 days a month. And if it's not something urgent or emergent, we can schedule those patients for those procedures and have them do things in a manner that fits their schedule. Because a big challenge here that ties in with all that is distance to the next facility. For example, there are locations that I've been in where if a breast biopsy is needed, a lady might have to drive 3 hours to get to another location to have a breast biopsy done. Whereas, if you have someone who can do those in time increments, maybe that particular type of procedure isn't something you want to wait for. But the more of those kinds of procedures that you can build that aren't urgent, then you prevent people from having to leave town. And then not only does it help the patient, it helps their families and the other people involved, because typically if someone has to leave town for a procedure, that means their family has to spend gas, they have to have hotels, all sorts of things. So that's one of the big pieces that I see growing more and more. Vascular procedures are another good example, probably a better example of something that maybe could wait a couple of weeks and have someone who's here for 2 or 3 days and get that scheduled. Another piece of innovation I think that's going to be important in small facilities, really in all facilities, but particularly for small facilities, is interacting with the businesses that are in their community. West Texas, Eastern New Mexico has a huge oil and gas industry, obviously. And so interacting with those folks on and finding out what the specific needs are for their employees are a huge piece of making sure that you're providing what the community needs and also creating a revenue stream for your organization. So that sort of communication in the community, I think, is going to be huge.
Excellent. So meeting people where they're at.
Yes, absolutely.
Huge. Okay, wonderful. All right. The scariest question that I ask everybody is, what do you think are the biggest threats to healthcare, to rural healthcare? So I'll start there.
Okay. I think healthcare as a whole, but in small hospitals in particular, is community perception. Um, a lot of times there's been lots in the news about how people view insurance companies and how they're putting profit over patients.
Okay.
But this is also something that's very important in a small hospital and how they interact with the community, what the community's perception is that we're not putting dollars over patient care. It's important that they understand that that the hospitals are here for their needs and for their care. Oftentimes, even in the small community, somebody may ride by that hospital on their way to work every day, but they don't really give it a lot of thought until they need health care. It's not something that people give a lot of thought to on a regular basis until it's something that's an immediate need.
Okay.
So it's important from a practical standpoint because we don't want people driving by an emergency room that could take care of a family member that's having chest pain because they think the hospital in the 35, 40 miles over can better take care of them. Right. So it's important, again, that we engage with people and they understand the capabilities of the facility, but they also need to, in a larger picture, understand that we're there for their needs. Right. ROIs, for example, return on investments, are done differently in a small facility because there are times when you take the hit financially because it's just the right thing to do for the community. Absolutely. But that community perception is a big threat to the small hospital, just like it is to large insurance companies. So it's important that we continue to educate the community and continue to have them understand what our capabilities are. The other threat that I don't think is talked about a lot is in their IT departments, in their information technology departments. We talk oftentimes about how difficult it is to bring clinical talent into small hospitals. Yeah. That same struggle exists with IT staff. There's a certain number of those folks that you can do hybrid work with or homework with, but there's also a certain number of those folks that you need to have on the ground. And so there's challenges from that standpoint. And the reason that I see it as a threat is because it doesn't get enough attention. We talk regularly about how many physicians and nurses and nurse practitioners and things that we do or don't have in a small facility, but we don't often talk about the knowledge base that we need in the IT space. Small facilities have the same challenges in the IT space that the large ones do. So that also is a threat that I don't think is talked about enough.
Well, I'm so happy to hear you say that last threat. I'm not happy to hear you say it, but I'm excited for my students to have them hear you say that, because I have a growing number of students that are interested in like health informatics, that are interested in information technology. And I think a growing number of them, are not sure like where do they fit in? Should they go work for like an EMR? Should they go? So for
Right.
you to say that, there's a need, that there's a need for them and that they fit in all kinds of places.
Right.
I think
Well,
it's
we
very
talked
valid.
about the different threads of healthcare and the different ways that you can be involved in healthcare and have a career in healthcare. The IT piece, the ancillary services, whether it's lab or imaging, sleep, cardiopulmonary. I mean, the list goes
Okay.
on and on.
So
And, those folks are becoming harder to come by as well. So, yes,
absolutely.
there are a number of different avenues that you can take.
Absolutely. I'm happy to hear that you just validated that. So thank you so much for sharing that need. All right. So what does the future of rural healthcare look like to you? And what role do leaders like you need to play in shaping it?
Well, we've talked about a number of the things that I think are going to be important: communicating with the community, our IT threats, how we recruit, all of those kinds of things. But how we also interact with the larger facilities, how we communicate with the larger facilities, how we train, how we teach, all of those things are going to be important.
Mhm.
Uh, One of the examples I would give you is the CEO here at Artesia and I recently had a conversation with some of the academic leadership at University of New Mexico,
Mm.
and there's programs that they have put in place to assist with new nurse practitioners that are coming straight out of training to help them. It's almost like an internship that you can do, and a lot of it's virtual. So we're trying to work through some of the details on that. But how we train and teach people in a rural environment who may only see a certain type of malady once a year or twice a year, that's going to be important. The business piece, how we continue to train our administrators. Those are all important things. And there's also a different mindset with the priorities. I mentioned earlier how we calculate financial pieces. Our return on investment may be a little differently. Maybe there's an infusion clinic that if we can prevent some person in our community who has a chronic illness from driving 4 hours to a large facility, but we have to take some financial hit in the process of doing that, then we want to do the right thing for the patient. So we have to make sure that our teams understand the priorities. That's the case in any facility, but how you align those priorities is a little different in a smaller facility.
Mhm.
Um, and we also have to make sure that we keep our head on the sort of the proverbial swivel. Right now, in particular, new legislation that's passed, those kinds of things, lots of moving targets and lots of issues that we don't completely have our head wrapped around yet.
Mhm.
So,
Yeah. And so you've woven this beautiful thread for me that, I'm not sure that maybe you intentionally did this, but I feel like the theme that you've laid out for us today is this concept of how necessary and beautifully it is, I think, for all healthcare leaders, but especially for rural healthcare leaders, that they have this element of collaboration that they must
absolutely.
master, like you just laid out this whole podcast. Because you're talking about communicating with patients, with staff. You're talking about dealing with universities and how you're training people. And that's actually how I met you, right? I met you an ACHE
ACHE, yeah.
conference, the American College of Healthcare Executives. So, I mean, how do you feel like the skill set of collaborating has impacted your career, and something like a professional association has impacted your career?
Well, I will tell you very candidly that I'm never the smartest guy in the room. I've never had. I sort of only half jokingly tell people I've never had an original thought in my life. Um,
I
I
doubt that.
but I do have the ability to interact with people, and I take ideas that other people have and mold and shape them into something that will fit what I need at the time. It's important from the pure idea standpoint. It's important from a psychological standpoint, particularly at a small facility, because it's very easy to feel isolated. Because oftentimes there may be just one of whatever type of person it is. So the more collaborating that you can do and get ideas from other places, and in the world we live in now, where you have this sort of technology like we're utilizing today, we need to utilize that to its fullest and take advantage of that. So, yes, the collaborating is very important, whether you're trying to understand the needs of your patients, understanding the needs of your community. Another piece that we didn't bring up earlier that I think is also important is retention. That's another piece that we are hyper focused on here. And again, it's not just about the clinicians. Obviously, the clinicians are very important, but we have efforts geared toward our EVS team, toward our dietary team, toward our front end staff, the people who are the first folks to talk with the patient when they walk in the door. So they provide a lot of the fundamental pieces for the organization. And if you're churning that staff, then it's hard to find stability in other parts.
Absolutely.
So we have to focus on those kind of folks as well.
Okay, excellent. All right. Well, those were all my questions, David. That was super helpful for giving us clarity, especially if any of the listeners are not fully aware of rural healthcare. I was listening to some of your work earlier where we talk about, you said something really interesting that I'd like to wrap up with. 20% of the population live in 97% of the landmass. Is that correct?
That is correct.
Which is sounds alarming, but then you quantified it, and this is all based on data, right? That's
Right.
about 60 million people. Is this US wide?
That's correct. Yep, it came from the census, and so the other part the other part of that discussion was, why should larger communities be concerned about what goes on in the smaller communities? You're talking about 20% of the population.
Right.
But one of the lessons from COVID was that the larger facilities do not have the bandwidth, the beds, the staff to manage all of the illness in the smaller communities. So even if you try to move all of those folks into the larger facilities, they don't have enough bandwidth to withstand it either.
Absolutely.
So it's important to them that the smaller facilities continue to function well also.
Yeah, and I think that saying 20% of the population minimizes it. When you say 60 million people, how do you take care of 60 million people? That, puts light on the situation. So I
Absolutely.
thank you so much for sharing that data with me earlier and for us to talk about that again. So thank you again, David, so much for the work that you're doing for our rural communities and for continuing to support healthcare leaders, the listeners for the Healthspark, and for helping us to share your knowledge today.
Great. Happy to do it. And if I can be of assistance to anybody, I'm out there on LinkedIn. So please feel free to reach out and contact me.
We're going to share all your social media links that you shared with us and your contact information.
Perfect.
Thank you again, David.
Thank you.
Thanks for listening to the Healthspark, Igniting Healthcare Management Change and Evolution. Please look out for future episodes and follow us on our social media pages.